Hello again. Oh, sorry about earlier. We're just having some issues here and trying to firefight. Um, hello. Hi, thank you for joining. Good evening. Sorry we're starting late. We had a bit of situation, and I'm just going to bring my guest in. Unfortunately, the consultant gynecologist is not able to join us tonight. She's had a bit of family situation, emergency. And so, but quickly before I bring my other guest in, I wanted to say hello everyone, welcome. This is our first IG live. But the enemy is trying to get us not to have this, but no, it's gonna happen. By his grace. This is our first IG live in 2025. And we're having a critical conversation around why women's pain is often dismissed, especially when it comes to conditions like fibroid, endometriosis, adenomyosis. But before I carry on, I wanted to share a scripture quickly, which I've been ruminating on, since this morning and initially actually at the beginning of the year. So the scripture is Isaiah 43:19. I'll read the NIV translation. It says, "See, I'm doing a new thing. Now it springs up. Do you not perceive it? I am making a way in the wilderness and streams in the wasteland." And I also like the easy translation. It says, "Look, I will do something that is new. It is already beginning to happen. Surely you can recognize it. Yes, I will make a road through the desert. I will make streams in the wilderness." And honestly, is an amazing year. It's a year that God is truly doing something new. It's a year of supernatural flourishing and fulfillment of God's purpose. And I pray that our eyes be open and our hearts be able to perceive what the Lord is doing in this season, that we may align with it, that will be like the sons of Issachar, to be able to discern the times and the season that we're in, and we receive the grace to perpetually be obedient to the Spirit of God in every area of our lives. It's a very important and key time that we're in, and I pray that we align, to what the Lord wants to do in this time and in this season. In Jesus' name, amen. I'm going to bring in my guest. I don't know if I'm waiting for her to join. My name is Toyin Taiwo. This is the Feminine Health and Fibroid Support Network. Our mission is to provide education, information, support, and raise awareness for women health issues. We advocate for better healthcare, support for women navigating reproductive health challenge. Today, unfortunately, the gynecologist is not able to join us, but I've got a patient's right advocate with me today, Yemisi Brockton, and she'll be sharing insights from my experience, around how we can better serve women, in this space, and stop ignoring women and minimizing women's pain. And honestly, this is not just a discussion; it's a call to action as well.
Yeah.
Women's pain is real, is valid, and deserves proper medical attention. And so welcome. Thank you for
Thank
joining me
you.
tonight.
Thanks for having me.
Please introduce yourself.
I'm Yemisi Broughton. I'm an advanced nurse practitioner. I'm a women's health specialist. I'm currently the lead of the women's health services at my GP surgery in Canterbury, one of the biggest GP GP surgeries in Kent. So yes, yeah, that's me. Well, I'm a mom. I've got two kids, 13 and 8-year-olds, and they're amazing. So yeah.
Oh, wow, oh, wow. Lovely, lovely. Thank you. Thank you for joining me tonight. And we're going to make the most of
Yes.
how this is going to go.
Let's do this.
Yes, let's do this. Let's do this. So I ask you a question,
Uh-huh.
and then you share insight. You
Yep.
tell us what your experience is
Mhm.
from the professional, and if you have useful instances where it's even personal, people close to you that it was not directly work, you
Mhm.
know. And let's have this conversation. Let's create awareness around this, and hopefully the right people are hearing us, and we can start to proffer solutions,
Yes.
basically. Yes. So, my first question today to you will be: so, what do you think? Why do you think women's pain is often dismissed in the healthcare setting? From your experience, from what you've seen.
Mm. So pain is highly subjective,
Mm-hmm.
okay? Because you can only measure pain by what the patient is telling you, all right? And because it's very subjective, they
True.
can use a pain scale to say, on a scale of 1 to 10,
Mm-hmm.
how big is your pain or how much is your pain.
Mm-hmm.
So that's why it's very, very difficult to quantify pain objectively. That's number one. Number two, as women, our pain threshold differs a lot.
Right.
Okay, it can go from a very high pain threshold to nil.
Okay.
But generally, we women, we tend to just get along with it. We just want to, okay, just a little bit more. I don't think the pain is that bad. At times, we could be dismissive
Mm-hmm.
ourselves of
Mm-hmm.
our
Mm-hmm.
pain levels because we have a lot of things we're grappling with. We've got family, you've got kids, you've got work, you've got a
True.
lot of people depending on you somewhat. And you're thinking, well, I will put my pain in the back burner for a little bit. So those are a couple of factors that play in, pain and how it is perceived, especially in women. Now, in the healthcare setting,
Mm-hmm. Mm-hmm.
like I said, a lot of us, we don't present on time
Mm-hmm.
with our pain
Mm-hmm.
because we try to manage it, we try to get on with it. And when we come in at times to talk to a healthcare professional about it, we may not be able to articulate how we're experiencing the pain,
Mm-hmm.
and which is one of the reasons why I always tell my patients, especially when it comes to period pain, I always say to them, it is not normal. A lot of people think, okay, it's normal to have a bit of a period pain, a bit of niggle here and there.
Mm-hmm.
No,
Mm-hmm.
it is actually not normal.
Mm-hmm.
One of the things I put up on my page this week is do not ignore a period pain. So
I
I
saw
think,
that. I saw
yeah,
that. Mm. That's interesting. It got me thinking about two different things.
yes,
And I mean, what I'm hearing is he who shouts the loudest, honestly. And
yes,
and
yeah,
I'm also thinking, um, because we have different thresholds.
yes,
I mean, A can come, and I mean, I don't see, one thing I don't like to do is minimize anybody's pain,
yeah,
because but how we can tolerate pain, it differs. So somebody who says having um, a very bad condition, I don't know,
hmm,
maybe let's say for instance,
yeah,
yeah, but some period pain. I don't even know how to find the best example, but
mm,
something on the
yeah,
extreme,
yes,
like maybe
yeah,
fibroid, serious one that you'll be flipping
hmm,
over, but because you have high
hmm,
pain threshold, and someone asks you to say, oh, because you're managing it, which we shouldn't be doing, but you're like, I'm fine. Maybe is a 7, is a 6, but somebody comes and they have, I don't
like
know,
two,
something else that's not as
hmm,
as measure,
yeah,
and they come and tell you, oh, it's a 9, and then they get the attention.
yeah,
But you who is there,
yeah,
that's and that's
mm,
interesting insight, honestly,
mm,
because these are also the things that we need to be making women aware that
Yes.
if the pain is bad, just let them know is a
It's a
9, is a
nine.
10. You know,
Yeah.
that's when you get the help
Mm,
quicker. Because if you keep saying, oh, he's a 6, is a
mm,
whatever, you're
mm.
managing the person who might not have
Yeah.
as serious a condition. Every
Mm.
health issue is
It's
important,
important. Yeah.
will get the
Mm.
attention, over you. So thank you for highlighting that, and it's important to just be able to not just manage the
Mm-hmm.
pain, especially when we are in a place where there's someone who can help us,
Yeah.
where with a professional who's
Mm-hmm.
trying to get to the bottom of helping us. We need to yes, be able to. And you said something about not being able to articulate it. One thing that I always say to women is have a journal. Have a
Yes.
journal, because for
Yes.
me,
Keep a diary. Mm-hmm.
have a journal, have
Mm-hmm.
a checklist.
Yeah.
If it's a condition that you've been with for a while, have a
Mm.
checklist. And so by the time you're speaking to your professional care provider, you're
Yeah.
saying, oh yeah, I had that. That way you're able to remember these
Yeah.
things. Yeah.
Mm.
So thank you for
Mm. But
calling that.
just to, you did say something about keeping a journal.
Mm-hmm.
Okay. One thing I have found useful for myself is using the menstrual app, the period app. Okay. Some of the apps actually helps you to make a note of all the symptoms you're experiencing at different stages of your cycle.
Mm-hmm.
So during your period, and pain is one of it, your mood changes,
Mm-hmm.
the changes in your body. So that might actually be a very useful one for women to consider using,
Mm-hmm.
keeping track of their symptoms, and it will show a trend. As it will give you a trend, it will analyze the trend for you, and that's something you can present to your healthcare professionals as well.
Amazing. I like. So, which one do you use? I like the fact that
So,
it can show you the trend, because that's really
yes.
key. In fact, a few days ago, I was speaking to my daughter, and she's got one of those apps. I've never had an app. I'm very old fashioned, but she was saying to me, I was asking her some questions, and she was
Mm-hmm.
answering me. And like, how did you know? She said, well, because I put it in my app and I
Yeah,
can see. I'm like, oh, you can do that?
yes,
She
you
said, oh,
can.
yes. I'm like, okay, that's really good. So
Yeah.
now you're saying as well. So it's something that we need
Mm.
to also be making people aware, or
Aware
women
of.
aware, that,
Yeah.
look, these are all of the gadgets and the things that you
Mm.
can use to help,
Yeah.
you know, collect your information and data
Mm-hmm.
around, you
How
know,
you're presenting with, yes.
absolutely. Thank
Mm.
you. Thank you for that as well. So my other question to you is going to be around, because I'm going to skip the one for the gynecologist since she's not here. That was for her for diagnosis.
Well, I
Okay, this one's
think I
for
can
you.
touch on diagnosis as well
Ah,
if it's something you wanted
okay,
to talk about.
okay.
Yes,
So
because it's part of my role.
okay, amazing. So how do medical biases impact the diagnosis and treatment of conditions like fibroid, endometriosis, and yeah.
Okay. So I will touch on endometriosis
Mm-hmm.
because fibroid, I think we're not doing too bad with diagnosing fibroid, okay? Because, well, it's not perfect.
Okay.
And I will explain the reason why I said that.
Let's
The reason
not
why
have
I
that
said that
conversation
is,
this night. Let me see,
mm,
because fibroid. Okay,
the
go
reason
on.
why I said that is you can use an ultrasound scan to diagnose fibroids.
Mm-hmm.
That one is easily accessible. Your general practitioner can refer you
Mm-hmm.
to it. But there are a lot of factors there as well that could possibly delay diagnosis of fibroids.
Mm-hmm.
But the reason why I want to touch on endometriosis in particular
Mm-hmm.
is one of the most difficult to diagnose.
Diagnose, yeah.
I was, because I'm a blogger, I write on women's health. I blog on women's health.
Okay.
So one of my articles I wrote was on endometriosis.
Right.
And when I was doing the research into that, on average, it takes about on 6 to 10 years to diagnose endometriosis. Yes. You can do, a woman has been presenting with period pain over and over again. They've done a lot of ultrasound scan, is not picking anything because ultrasound scan will not pick up endometriosis. That is not how you diagnose endometriosis.
How do you diagnose
So
endometriosis?
endometriosis is diagnosed by a procedure we call laparoscopy.
Okay.
Okay. That is the best way to diagnose endometriosis properly, to get a full understanding of, number one, the endometriosis, the extent of it, and as it spread to, how it's impacting you. Laparoscopy is actually the best form of that. You can use MRI scan as well.
So at what point, because you just said it can take up to 6 to 10 years.
Yep.
At what point, when a woman has complained severally about severe period, but at what point does she get offered a laparoscopy?
That is a very good question, and that is where the gap is, and that's what we're trying to bridge. We're trying to bridge that gap because laparoscopy, well, I work in a primary care, okay, and usually primary care is the first point of contact. Now, we would try in the primary care to exhaust, what resources is available to us. Laparoscopy is more of a secondary care. Like if your gynecologist guest, if she were here, she would be the person we would refer to and who would make a decision to do a laparoscopy. Now, the thing with us in the primary care is we need to start referring earlier. We need to start referring earlier. So a woman comes in, in my women's health clinic, if I see, say for instance, I see a young lady, say in her 20s, and she comes in with an extensive history of period pain. Yes, I would do a pelvic ultrasound scan. Let's just do that first. Come back to see me after the result. If the result comes back normal, and I will make sure that I literally book her in to come back to see me because I want to follow this through. I don't want her to fall through the loop. Okay. She comes back to see me. If the scan comes back normal, I will be referring her on to the gynecologist. And in my referral, I will put, kindly consider possible endometriosis as a cause of the period pain. Okay, so in the healthcare, we need to be referring earlier than we usually do, so it doesn't take that long to diagnose them, because a lot of women suffer. They suffer. They just suffer for no reason, because of this.
Thank you for that. So honestly, it's about referring earlier now, and not waiting too long, and not So and I like the fact that you said, so this is the young lady's first visit, and she's complained of severe period pain, and for you, next step is once her results come and everything is fine, you quickly want to go to referring to check for. And
I would want to do that. However, it depends on the history that she has given to me as well. Don't forget that. History getting the history from the woman is extremely important. And it would depend on how long she has been experiencing it, what has she tried, what has she taken, what has helped, what has not helped, how is it impacting her life generally? How is it impacting her daily activity or her relationship? Where is the pain? A sexual history, a family medical history. So there will be a lot of things that I will have to put into consideration before I go beeline for referral. But the key point here is, as healthcare professionals, we need to be highly knowledgeable. We need to understand the right questions to ask this woman so we can know how to get the right response and make a decision.
Thank you. Thank you. That is so important. Be knowledgeable and know how to ask the right questions to be able to help the woman. Thank you. That is so amazing. I hope people are listening to this, because we need we need women to be heard. We need better health care for women. Thank you. Thank you for that. I wanted to ask you also, so how would you advise women experiencing pain but struggling to get diagnosis and proper treatment? I know this is what you've just said now. So what will you say to women to do differently?
Oh, that's a very good question. And it comes again to knowing how to present it to your healthcare professional. Okay. And using the menstrual app is one example. It's you can see it's there. You've got the data of what is going on, how your cycle is, how it's affecting you. You've got the data. That is number one. Number two, being able to present your history. Okay, I started having my period. It is just a case scenario. Okay, I started my period at the age of. Now, before I do that, mind you, there are different types of period pain. We've got primary and the secondary period pain. Okay. So let's say a 20-year-old or mid-20s, approached me and said, I started my period at the age of 13. I never had a period pain. I was absolutely okay up until the age of 20. Then in my head, I'll be thinking, this is a secondary period pain. All right. She did not start a period with period pain, but she started later on.
Okay.
Something is going on. All right. So I was like, okay, fine. Tell me, when in your cycle do you start having this pain? Do you experience this pain mid-cycle? Mid-cycle is usually when you're ovulating. Do you experience this pain mid-cycle, or is it before or just days before you start your period, or when you start your period? When you experience the pain is important. Okay. Where the pain is important. Is it one-sided? Is it lower abdomen? Do you experience pain? When you're on your period and you open your bowels, do you experience pain? If a woman comes to me and say, when I open my bowels during my period, I have a lot of cramps and pain, I'm thinking endometriosis, bowel endometriosis. I will be thinking that. So when you experience the pain, is really important as well. For fibroid, I'm having back pain, constant back pain. It's like pressure. It's just like something is sitting. I'll be thinking fibroid, possible. All right. If a lady comes to me and say, well, I started my period a year ago and I've been experiencing pain, it's still crampy, I'm thinking primary period pain, possibly hormonal. It's not caused by things like fibroid endometriosis. It could be hormonal. So letting your healthcare professional know when you experience the pain, the nature of the pain, where is it? How long does it last for? And how is it affecting you? When I have this pain, I cannot possibly, I'm literally crouching over to manage this pain or to be comfortable, or I'm constantly having to apply hot water bottle. Being able to explain all of this will let us know the extent that this pain is affecting you. All right. So explaining, letting us know. Number one. Number two, you may need more than one appointment for this. Okay. One of the reasons, women might find themselves being rushed. Anytime I go to see my GP, I'm always rushed. It's like he or she's always like, all right, okay.
Like, bye. Book another appointment.
It's managing, it's understanding that in as much as we're advocating for patients, we also need to look, because I work in the system and I know. So
you're overwhelmed.
I will encourage ladies to understand that they may not be able to convey all of this in one appointment. They can actually request. Number one, you can say, can I have a double appointment? Because what I want to discuss, it cannot happen in 10 minutes. you can request
Really
for a double appointment. Yes, you
interesting.
have the
Okay,
right
nice
to
to
do
know.
that. You can. Or you can say, if I can't get a double appointment,
Hmm.
can I book a follow-up appointment?
Mm,
You can
right.
request for that. All right. So just making sure that you have enough time
Mm,
to get, to be able to give your history and the information that you need. It's okay to do a little bit of research before you go in to see your healthcare professional. Now, I'm saying that very cautiously
mm-hmm.
because where you get information from, the information out there is huge, it's massive.
Yeah.
So it can be quite overwhelming and confusing. So be careful with that. I would
When
say
you go
that,
to Dr. Google, you are alarmed. You are thinking, oh God, you are dying,
yeah.
So,
So I would say be cautious with that, all right? However, if you go to like NHS website, you will get some information there, all right, that can help you to present your case a little bit better to your healthcare professional. And
do a bit of homework, do
to
some fact finding,
yeah,
do some digging, and be
and
informed about your situation. And then,
informed.
yeah.
And also let your GP or your nurse practitioner know what you've done. I have done this, 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 and this, and it hasn't worked. So we don't ask you to go and do those things again. All right. If you've spoken with a lot of people use private healthcare. A
Mm-hmm.
lot of people use that, which is
Mm-hmm.
amazing. So
Mm-hmm.
for whatever reason, if you've consulted with a private gynecologist, a women's health specialist, or even a friend that is a medical person, and they've given you an advice or they've said something to you, it's okay to mention it to us. Oh, I spoke with a friend of mine who is a GP or is a doctor, and she said this, and this. So it gets us thinking, it gives us an idea it gives us a perspective of where you're coming from and what you've done so we can know where to start from.
Okay. All right. Thank you for this amazing insight. But okay, I'm going to go to the other side where everyone is just as thorough as you are or as
Yep.
you've experienced. So how
Yes.
can women effectively advocate for themselves and say, look, I'm feeling unheard? How can women, you know, push back, if you like, or just put up their
Yeah.
opinions there to say, look, I'm feeling unheard, my pain has been minimized, or whatever it is? How do you advise
You can
women to yes.
you can ask for a second opinion. Okay?
Hmm.
So let's say for instance you've been seeing the same healthcare professional and you don't feel heard by them. Request to see somebody else. You can do that.
Mm-hmm. So
Okay?
someone else
Yeah,
from the
you can do that. You can also we do something in the primary care. It's called advice and guidance to the gynecologist.
mm-hmm.
Okay, so when we're not necessarily referring, fully, or if we have a question
Mm-hmm.
that we need a very quick answer to,
Mm-hmm.
we will send an advice and guidance to the gynecologist and say, okay, I've got this lady with me. She's presenting with this, and this. I'm a little bit stumped. I'm not quite sure what to do next with her. Do you have any professional or specialist advice? Yes, we do that quite a lot. I do that.
Okay.
That liaison is there, and you get a quicker, a swifter. It may take a slightly longer, but you will get an answer. That one is actually a quicker way of liaising with a specialist for a woman that you're not quite, maybe there's a knowledge gap in your women's health and you don't
Mm-hmm.
quite fully understand. Healthcare professionals can use, advice and guidance, to get a little support
Yeah.
from the gynecologist.
Okay.
A woman could suggest, I'm saying that cautiously as well, because like, oh, I'm teaching you your job, I'm teaching you what to do. We don't want it to come across that way. You could just say, suggesting very politely
Mm-hmm.
that is it possible to get, the opinion of the gynecologist, maybe you know, send them, my history and see if there's something they can advise us to do.
Absolutely.
You know, in a very polite way, you can present that. You're a healthcare professional, you know. So yeah.
So basically asking for a second opinion. I like what Mom 2020 have just put down. She said you can actually visit your GP with an advocate. I didn't know you could do that.
Yeah.
Interesting. So ladies, you can go to your doctor with an advocate.
Yeah.
Somebody who is well experienced, informed, and educated about your situation and your condition, and go with you to your appointment. Amazing. Amazing. Thank you so much for that. Thank you, Mom 2020, for that. You know, and thank you, MEC, for your insight. So whilst we're here, I know earlier on you talked about on for endometriosis. I know because different condition, different testing, but what are there basic specific tests or assessment that you could recommend for women who feel the pain is being dismissed? What's the quick, like, okay, I know that you've said, oh, ask for a second opinion or ask to speak to someone else. Is there anything, quick assessment test that even the woman can say, okay, can I get tested for this? Can I do this? You know, how can you guys?
Okay. All right. So, again, I'm going to generalize here a little, but I'm going to put a disclaimer out there. This is a general advice, is not individualized. Healthcare is highly individualized. So I am not prescribing any, treatment, or I'm not prescribing an investigation here right now. But these are general things that can be done, but it not depends on individual presentation. Okay. A very quick, simple one that we always do, one-off with period pain that we don't have an answer to, is ultrasound scan. Okay. Right. Ultrasound scan is quick, is not that expensive, it's not invasive, right? And it can give us a lot of answers to some of these questions of period pain. All right. There are more more enhanced imaging, like MRI scan or CT scan and all of that. But the one that you can readily request for is ultrasound scan, pelvic ultrasound scan. Just to have a look at your ovaries, your uterus, your womb, and to see if everything is okay. And most healthcare professionals, we would do that. Well, we should do that.
What? As long as the lady's not dealing with the endometriosis, because that won't pick endometriosis. But so ultrasound will pick most things.
It will pick something like fibroid, well-defined. Ultrasound scan is relatively okay to pick up fibroids. There are times on the scan that the fibroid may not be well defined. The sonographer may say, it's suspected, not quite. They can use words like fibrocystic changes, something like that. They might use some terms, some terminologies, like we're suspecting, we're not sure. In that case, we will send for something like an MRI pelvis or CT scan, just to give us an enhanced understanding of what is going on. Blood tests are another easy ones to do, because when we talk about period pain, some ladies that have polycystic ovary, that is, they can present with a form of period pain as well. And don't forget, period pain also comes hand in hand at times with heavy period flow. You have your period is really heavy, clotty, and all of that. That can lead to anemia. So that means you're low iron. So blood tests will pick all of those things associated with period pain.
Okay. So blood tests is a quick one, and also ultrasound.
Yeah, but then again, don't forget, as I said, a disclaimer out there, this is a generalized, it needs to be more personalized and individualized for you.
Awesome. Thank you for that guidance. Thank you. I was going to ask you this later, but let's just do it, this one now, and then Can you share any real, of course, without names, any real life cases where advocacy or proper diagnosis led to a significant change in a woman's healthcare outcome? You know any?
Honestly, I say this all the time. um, even in my, I had a clinic today. Even in my clinic today, there's still this woman that, okay, I just picked up. She came on my list for blood test results for me to discuss it. And when I checked the hemoglobin, it was about 95, 90, I think, if I remember correctly. And it's supposed to be about 125 and above. I was like, what? What's going on? And looking back, so because when you look at blood, you see what the history has been previously.
Mm-hmm.
And I can see that a higher level has been low for over a year.
Mm.
And I'm thinking, what has been done? And my very first question, because of her age,
Mm-hmm.
she's within the age of reproductive age. And I said to her, tell me about your period. That was my very first question.
Mm-hmm.
Tell me about your period. And she was like, well, it's pretty heavy. If it's not even painful, not particularly painful, but very heavy period. She would bleed for 5 days, heavy with clots. I know. I said, okay. I said, have you ever had a scan done? She said, no. And this is something that's been going on for nearly a year. And straight off, I just sent her for an ultrasound scan.
Mm.
That was today. Okay, so of course I'm still waiting for what the result will be.
Mm-hmm.
But the previous ones that I have done, because again I see a lot of this in my women's
Mm-hmm.
health clinic,
Mm-hmm.
they've come up with a lot of fibroids.
Mm.
Fibroid is the most common ones.
Oh.
It's the
Mm-hmm.
most common ones, especially, I work in two places. The other place where I do, just part-time work there,
Mm-hmm.
the population is more of Afro-Caribbean. There's a high percentage of that. So we see a lot of uterine fibroids there, and that is one major one that keeps coming up with
Mm-hmm.
investigations. Yeah.
Wow. Okay. So, is it something that, okay, this is you because that's close to work for you.
Yeah.
I'm I'm wanting to assume that some of your colleagues as well are picking this up.
Oh,
Is there
yes.
is there any focus group discussion? Is there anything
Mm.
that is happening or is going to be happening to why are you laughing? To be able to start to discuss this thing, knowing that it's
Mm.
an epidemic now,
Mm. Mm.
a lot
Yeah.
of women affected. Is there any systemic thing that's
Mm.
improved what?
Mm. Well, in my GP surgery, we do
Mm-hmm.
something we call clinical meetings every week.
Mm-hmm.
Okay. And it's not just my GP surgery. In other places I've worked, clinical meetings are quite common things that we do, because those are the meetings where we look at cases that like a presentation, we bring about a case, I will present it,
Mm-hmm.
how best to manage it, things like that. We had one of our clinical meetings recently, and it was purely on women's health. Okay, it was dedicated only for women's
Right.
health. And myself and another colleague of mine, she's also on the women's health team, we were able to talk about. So this time around, actually, we were talking more about menorrhagia, which is heavy menstrual flow,
Mm-hmm.
heavy period. We were talking about that, and we're talking about how to manage it, a few things that are available to manage it, and HRT as well. We spoke about HRT. So in local GP surgeries, there are a lot of clinical meetings. That is the immediate place where we can bridge the knowledge gap. Okay, that where we healthcare professionals can advocate more, be more knowledgeable about women's health, issues about women's health, but then again, it depends on if you have someone that is passionate about it, number one, at the surgery, or someone that, or if they have like a specialized department on that, like we have where we are. So that is one place where we can do that. At the government level, policy making,
How much noise do
policies,
we need to be making now for this to be taken seriously?
policies, policies. Yes, yeah, yeah. We just, there was a time, if I remember correctly, please bear with me, don't quote me on this. I think about a couple of years ago, there was a massive survey that was done on women's health
Mhm,
by the government
mhm.
then, and that actually led to a policy on promoting women's health.
Right.
Promoting women's health. I will try and get that information and send it to you.
Okay.
Okay. I don't want to give, I would really prefer to give a more precise information about that, but I know there was a massive study that was done. A lot of surveys were sent out, questionnaires, collated data,
Mhm,
and it was presented actually to the Department of Health
mhm.
at that time about women, and I think it's developed into a policy now. But I need to get information on that. I'm happy to send it to you.
Thank you. That'll be useful. And also, honestly, we need to start getting the numbers in, because like when we started this is who makes the most noise, I get
Yeah.
get the attention. So I also think we need to start to, through surveys that we might be doing and questionnaires, and
Mm-hmm.
that's some of the things that the Feminine Health and Fiber Network this year. I mean, we have two already that we're trying to start to
Mm.
circulate, and the more that we can get, because we need the
Yeah.
numbers, and we need to collaborate with
Mm-hmm.
everyone who is in this trying to. We need to make the noise that
Yeah.
somebody needs to be hearing,
Mm-hmm.
and
Yes.
systems needs to start to change, honestly, and policies need to start to
Mm.
change to be able to women, because a lot of women,
Mm.
my particular issue was fibroid, still is, and so the thing is everywhere.
Mm.
The thing is everywhere.
Yeah.
And we cannot be quiet anymore to say we can't
Mm.
ignore it. You
Yes.
know,
No, we can. No, not at all. We
you
cannot
know.
ignore it.
And I'm glad
Yeah.
you said that. Most of the cases, keeps coming back with
Mm.
fibroid and all of that.
Yeah.
Everyone's got, not everyone, most people have got this thing.
Most people have got it. Yeah, I've had a personal experience with fibroid before, and I think I was about 25.
Hmm.
Actually, I was about 24, 25. Um, Now my period has always been light, bleed for like 2 days, 3 days, done, dusted. I I'd never have period pain, never did. Two of my sisters had terrible, terrible period pain,
Mm.
but for me, I can start my period without even knowing that I started. I'll finish. My life goes on as
So when
normal. Just to let you
I find
know,
fibroid at 20 what?
24, 24, 25.
Mm.
So I went abroad and my period flow that month was so heavy. I was like, what? This is so abnormal for me. I never bleed heavy.
Mm.
And it was painful,
Mm.
excruciatingly painful. I was like, okay. So as soon as I got back to UK, my first thing was to book an appointment with my GP. I said, listen, my period last month was horrendous. That is not me. And lo and behold, did an ultrasound scan. It was actually a very tiny fibroid. Pretty, if a tiny fibroid can cause that problem,
Mm.
imagine
How?
those grappling with the
Forget
larger,
the big
several ones.
numbers. So how many did you have? Something.
Just one,
Oh,
tiny.
oh,
And it
you
caused
were like,
a lot of problems. So I cannot imagine that. Multiply that 100 times for other women that have got several and large
and
ones as
and
well. So
so,
yeah,
the thing is horrific.
yes.
Honestly, it is horrific.
Mm, mm-hmm.
For the people. So I mean, I absolutely do understand and do get it, but the whole idea of this conversation, honestly, is a call to action.
Yes.
To say what can we do differently, what can be done, how can women start to engage differently
Yeah.
to get better outcome. I
Mm-hmm.
know earlier on, bless you, NHS. They're trying their best. They're overwhelmed and whatnot. Earlier on, you talked about going private, and all of those. So I mean, I've said it before. Sometimes we think, oh, it's not affordable. Oh, it's private. Sometimes it's just being intentional about that monthly subscription. You can get as low as 35, I think, £30 per month, and it's for your own peace of mind. Because, but I know that some of the primary cares are doing fantastic work around also aligning with private gynecologists to be able to help women and speed process up and all of that. And kudos to them and well done to them. But still, a lot of women are still suffering who are not getting seen. Well, my situation is a story for another day. It's not today. But honestly, it was out of desperation that I eventually had to go and find help from private. And the treatment that I got, because I was paying, was absolutely different from what I had at NHS. But that's life. It doesn't matter where I am. I should, but
get good care.
Yeah, but we're here now. But honestly, this is all about just getting the better treatment for women, and also being able to empower women to know how to engage, especially when you. And I read somebody earlier on said, have you ever been told that your pain was in your head or?
Oh yeah. I've heard a lot of that. Oh yeah.
So what you felt otherwise, how did that make you feel? So, and that's what we're trying to say. Women, don't let anyone minimize your pain.
Minimize your pain.
Yes.
Ask for a second opinion. Speak to somebody else.
That's going to lead me to one question I was going to say, that how can women prepare for their medical appointment? I know that someone mentioned go with an advocate to your appointment. I didn't even know you could do that.
But you can do.
Now we know.
You can do.
So go to your appointment with an advocate. Keep a diary and app. Let's use the app. Let's get the trends. Let's get all our data. Data don't lie. If you have something that you can go and say, look, this is my trend. This is my pattern. It's not even me telling you anything. Data is there. No one can fight that. So get those apps. I'll get a list of a few and maybe just post, and so women can just be guided around which app and what's giving you best trend. Or if you know anyone that you're using that's good, give us a shout out or put it in the chat or send us a message. But this is just all about helping women, empowering women. Someone else said many people do not know what a normal period is because we often do not compare. We are ignorant of our own bodies, and more education in primary and secondary school. Let's keep talking. Absolutely, that's some of the things that we're doing this year. Thank you, Mama 20. Absolutely, more education in secondary school and primary school as well. Around this educate younger women, younger generation around it. Honestly, really key, really important. I am grateful for this conversation that we're having today. So, are there any protocols? I know that this was similar to something I asked earlier on, but is there any protocol that is being put in place to help bridge the gap in this issue of gap in the healthcare and diagnosis and helping women have better healthcare?
So could you rephrase that question, please?
Is there any protocol? Okay, like I know you can only maybe speak from your own work and experience on your primary care. Is there any protocol that you've got in place? Is there any
policies?
So, not necessarily policies, like
protocol, like
well, how you will check, what you will check, and so is that a protocol that's uniform, that is consistent, or is it just if you're lucky to meet the thorough healthcare person or the nurse who's going to look after you, then you're lucky. So it's not a protocol. It's not something that's universal. Is it consistent? Is there any consistent protocol that you know to help bridge this gap? I know you said the other time you had like a conference where it was just purely about women's health, but is there any other thing? Is there a protocol that you
Okay, there are guidelines actually. There are health guidelines. So we have the NICE guidelines, okay. We have the Faculty of Sexual and Reproductive Health guidelines, and that talks about problematic bleeding guidelines, how to manage it. And in there you will find period pain as well. So yeah, there are NICE guidelines are like the government health, the national health guidelines, for healthcare professionals that we follow, that we what word do I want to use now, that we refer to on a number of things, that we need, that will guide us in managing different cases. But this guide, at times, a patient presenting is not textbook. Okay, so there is a place of your background. My background is nursing, okay, although I'm an advanced nurse practitioner now. So the medical and the doctors, the medical knowledge, you have to be able to bring in your medical knowledge into this guidelines, thinking outside of the box, because the patients are not textbook. They will not follow the guidelines. They will not tick all the boxes. There are times that they will divert, and there's a tangent that you're thinking, okay, how do you bring that back? So, your knowledge, your medical knowledge, as well as using these guidelines, the Faculty of Sexual and Reproductive Health, they have robust guidelines on contraception. One of them is also problematic bleeding. And so, yeah, there are a few guidelines out there that healthcare professionals can access.
Okay. So, I mean, I guess probably be a useful thing as well is it something that's public knowledge? Is it something that's out there that you can go to NHS website and see?
So these guidelines are mostly for healthcare professionals.
I'm asking that is, so when a woman goes to see a healthcare professional and they're not being thoroughly, guided and advised, and then because if I found it on any website, for instance, and I know the protocol myself, I know the guidelines, so I'm going to be saying to you, you didn't check this, or you didn't ask me this, so this is why I'm asking if is it public?
Oh yeah, it's out there. It's out there in the public domain, absolutely accessible. But then again, by all means, it's out there, for anyone to access. But again, like I said, all of these things are generalized. Okay, that's why I said most women are not textbook, so they will not necessarily take So if you look at the guidelines and you're looking at how you're presenting, it may not necessarily follow line by line. Yeah, you may get a lot of, okay, I have that, I have that, I have that, I have that. But I don't have that quite necessarily. So that is why we need to make sure that we personalize and individualize the care. But the guidelines are out there on the internet. You can access it. You may not necessarily understand some of the medical jargons there, because there are quite a lot of medical jargons there. But yeah.
Amazing. So that's
but
another
one website. Okay, so for patients, a couple of websites I would recommend, because going through guidelines might not be the best way to approach this, because it may confuse more than help. If you know what I mean. Because
go to Dr. Google.
Exactly, may confuse more than help. However, there are some specific websites that are for patients.
Please.
There is one that is patient.co.uk. It's absolutely fantastic. Patient.co.uk.
Okay.
If you go there and type in period pain, type in endometriosis, type in uterine fibroids. It will show you two. One is for patients and one is for healthcare professionals.
Okay.
Go to the one for patients. It has lots of information there. It will even give you some ideas of some tests and investigations that could be recommended as well for you. So patient.co.uk is one that I would recommend for women to access.
Amazing.
Okay. NHS website, you can do that alongside NHS UK as well, because that also will give you some basic information. Yeah. But using the NICE guidelines of the Faculty of Sexual Health Guide, trust me, when you open the document, it's about 200 pages, and you're thinking, where am I going to start from? So I will not readily recommend. I don't think it's going to help much, but the patient.co.uk would be a good one. Yeah.
So thank you for that, because honestly, anything to get women armed, informed, so when they're having their appointment, you're prepared as well as a patient. And then it helps you ask the right kind of questions, isn't it? Because when you've read, you're informed and educated about this situation, and you've read and you can challenge some things as well, and somebody just brushes something aside, like, no, can we do this? And it's a powerful place
to be. Absolutely. And that is actually one of the reasons why I got into blogging as well. If you look at my website and all the articles I've written there, they're all actually about giving information to women. Information about different things. Take this with you. It will empower you. It will empower you. And then you know the right questions to ask. All right. You know the right things to request for. That has always been my passion. And I put a lot of information on that website.
Well done. That's amazing. That's good stuff, because women need to be informed. They need to be educated, about their condition. So that way, they're better informed. They're able to ask the right kind of question, and they're able to get better outcome. Somebody, Mama 2020 is on fire today. She said, is there a guidance on how health professionals talk about a woman's weight gain when they have endometriosis? It's not even funny. A family member had a horrific and disrespectful medic who was brutal. Oh my God. I'm so sorry to hear that. I'm not even laughing because I'm laughing because I've not directly had it like that, but I've had situations where people, are so mean when they're talking about, oh, have you tried to lose some weight first before you're complaining about this and that? And there's a way to do these things, and people can make you, sometimes the health care professional make you feel really awful, and they're supposed to be helping you and helping your journey to wellness. Just asking if there's any guidance about that.
We just need to be more, show more empathy. Empathy. And me being a woman makes it easier for me because I'm a woman. I know how it feels. I've been there. So when someone comes in to talk to me, he's like, literally, she's telling my story. And I'm nodding my head like this because everything she's saying is like, I know. I understand you where you're coming from. So it's more of empathy and understanding that, like, someone's weight, when they know, you don't even have to tell them. They know that they know personally that it is something.
Make them feel worse than they already are feeling.
I know it's a very sensitive topic when it comes to obesity, when it comes to body weight. It's extremely sensitive topic. So we need to approach it very carefully, in as much as we want to talk about it, we want to give advice, we want to support the woman. We need to be tactical, and we need to be very tactical and be more sensitive in our approach. I agree. I totally agree.
and honestly, I mean, there's no way to make there's no need to make anyone feel worse that they're already
Then they're ready, yeah.
You know, I was laughing, I was smiling because before, so I had a bad outcome, which shouldn't be because of a lot of things, but my story is for another day. I've had to have a hysterectomy. But I remember when I was going through and it was really bad, I was bleeding like non-stop for a long time. Anyway, so someone who was looking after me insinuated that, oh, try and lose the weight. Maybe when you lose the weight, you wouldn't have fibroids. I'm like, really? And then a family friend, she is skinny, like proper skinny. So when she came to me, I said, oh, they say I have fibroid. I'm like, you got fibroid? So why is it I only I'm on the big side and you are the skinniest, you know? So, and sometimes it's okay, yes, that
it's a risk factor,
losing the weight,
yeah, not necessarily.
and all of that, but it's not even about that.
Yeah.
It's not even about that. I know skinny, very skinny people who have fibroids.
Of course,
you know.
yes.
So, and I'm sure even across other, and endometriosis for 18 years from a teenager, now early 30s, a horrid experience and journey. Wish I was there to. I didn't get that, but yeah, honestly, it's and even on a general level, just be respectful and honor other people. There's no big deal with that. There's no need to be mean to people. You know. Oh, it's been lovely talking to you today.
Thanks for having me.
Sharing your knowledge and insight, some of these things. But like I said, honestly, this is not just about having conversations, about looking for how we can profit a solution to help give women a better give women better health and get women getting better, being well generally.
Absolutely, yeah.
So please share we're going to share apps and what was the other thing? We already have the website, so you told us about
the government policy. I was trying to get it up on my laptop.
We'll share that if you've got oh, thank you so much, Mom 2020. Thank you everyone who's joined today. I hope it's been useful. I hope you've been able to take something away. If we didn't answer your question, apologies. I'm trying to scroll through and see this is about the weight one. How can we as a community support each other in demanding better healthcare for women? We talked a bit about that. It's now the government is going to be about policies. You know, thank you everyone who's joined today. I hope this has been useful, and I hope that if you have.
I found the sorry to interrupt you. I found the it's called Women's Health Strategy for England. Is on Department of Health and Social Care website.
England.
Is Women's Health Strategy for England. So it talks about more about health and social care. Say that again.
Is that a paper? Oh, what was
that? Yes, it's actually like a strategy.
Was it from last year?
No, 2022. There's one for 2022. That's what I've got here. Well, this one is the easy to read one. Like just summary.
Okay. Okay, if you've got that, if you share with me, please, I'll probably just put that out as well.
I'll do that,
and have that. Any arsenal that women can have to just
yes, that's actually a very good one for
better outcome for themselves, and it's really key. Thank you so much for your time today, MC. I really
pleasure.
Thank you.
Thanks for having me. I appreciate, really appreciate that. Thank you
for coming. Thank you for sharing your knowledge and your skills. We are grateful. Thank you. And I'm sure women have been able to take one or two things away today that will be helpful. Thank you very much. Have a lovely evening. God bless you.
Well, and you too. Take care. Bye-bye.
God bless. Good night.
Good night.
Good night, everyone. God bless you. Thanks for joining.